All right, let's dive into this. Parathyroidectomy, right? Specifically for people with end-stage renal disease.
Hmm.
Looks like you've been doing some serious research, huh? Lots of medical papers here. You really want to get this.
That's important stuff.
Yeah, I mean, who wouldn't want to understand the when, the why, the how of this whole procedure?
Absolutely.
So let's break it down. One thing that jumped out at me was the trend in parathyroidectomy rates. It's like a roller coaster.
Oh, yeah.
They went down, then up, and now it seems like they might be going down again. What do you make of that?
Well, it's interesting, isn't it? The initial drop, I think, that probably has a lot to do with improvements in how we manage phosphorus levels these days.
Makes sense.
Yeah, better management, less need for surgery, but then back up they went. Now, one of the studies you sent over, it suggests that these newer medications, like cinacalcet, they could be playing a role in the recent decline.
Oh, interesting. So they're helping to control those parathyroid hormone
Yeah.
levels.
Potentially, yeah. Could mean fewer people needing surgery. It's promising.
Yeah, definitely something to keep an eye on. But for someone listening right now trying to figure this all out, the big question is, when does this surgery, this parathyroidectomy, actually become like a must-do? It can't just be about having high PTH levels, can it?
No, no, you're right. It's not quite that simple. It's about the consequences, you see, the domino effect. Like if those high levels lead to severe hypercalcemia.
Too much calcium in the blood.
Exactly. Or if you have bone disease that's just not responding to anything else, that's when surgery really becomes crucial.
Got it. So those are some serious warning signs. What else should people be on the lookout for?
Well, persistent itching, like the kind that just won't go away.
Oh, I can imagine that would be awful.
And calciphylaxis. That's a dangerous buildup of calcium outside the bones.
Yeah.
Those are situations where surgery might be the best way to turn things around. But, and this is a big but, before anyone jumps to surgery,
Yeah.
you've got to rule out other things, other conditions that could be mimicking hyperparathyroidism.
Oh, like what? What kind of things?
Well, aluminum toxicity, that's one. It can look a lot like hyperparathyroidism, and if you do the surgery when it's actually aluminum toxicity,
Oh, no.
it can actually make things worse. Yeah, not good. That's why a bone biopsy, if there's any suspicion of aluminum exposure, is so important.
So important to get that right. Now, I got to ask about this term I came across. It sounds scary. Hungry bone syndrome.
Hungry bone
Oh,
syndrome.
what is that all about?
It does sound a bit ominous, doesn't it?
Yeah.
It's something that can happen after the surgery, especially if your PTH levels were super high before. Basically, you remove those overactive glands, and suddenly the bones are like, wait, where's all the calcium?
They're used to feasting, and now the feast is over.
Yeah. They go into overdrive trying to grab calcium from wherever they can.
Yeah.
And that can cause problems.
What kind of problems?
Seizures even. Fractures. It's serious stuff.
Wow. So managing that is super important.
Absolutely. Definitely something to talk to your doctor about. Now, about those surgical approaches.
Yeah. There are a few, aren't there?
Subtotal parathyroidectomy, total parathyroidectomy with autotransplantation.
And then just straight up total parathyroidectomy.
Right.
Kind of a lot to wrap your head around.
It is. It is. So let's start with subtotal parathyroidectomy. What do you think that means?
Subtotal. So taking out some of the parathyroid tissue, but not all of it.
Exactly. The idea is to leave behind just enough to keep things balanced, keep those calcium levels where they should be.
So you're walking a tightrope, getting rid of the problem, but not going too far.
Yeah, that's a good way to put it. But of course, there's a trade-off.
There always is, right?
Always. Leaving some tissue behind means there's a chance it could become overactive again. Higher risk of recurrence.
So it's a gamble, in a way. Will that remaining tissue behave or not?
You got it. Now, total parathyroidectomy with autotransplantation.
That sounds more complex.
It is a bit more involved.
Right.
We take out all the parathyroid glands, but then we take a little piece of that tissue.
A little piece.
Yeah, and we implant it, usually in the forearm.
So it's like a backup parathyroid gland?
You got it. A safety net. But even with this backup, things can still go wrong.
Oh, how so?
The transplanted tissue, it might not function properly, or it could become overactive. And then you're back to square one with recurrent hyperparathyroidism.
Wow. So even with the backup, there's no guarantee.
That's right. And then, of course, there's the total parathyroidectomy without the autotransplantation.
Just take it all out.
That's the one. Lowest risk of recurrence because there's nothing left to cause problems. But higher risk of ending up with permanent hypoparathyroidism, meaning your body can't regulate calcium on its own anymore.
So you need medication for life.
Calcium and vitamin D, yeah.
Yeah.
So you see, each approach has its pluses and minuses.
No easy answers.
No easy answers. It's about having that conversation with your doctor weighing all the factors and figuring out what makes the most sense for you.
Shared decision-making at its finest.
Exactly.
All right, so we've talked about why someone might need this surgery, the different ways to do it. Now, what about life after parathyroidectomy? What's the long-term outlook like?
Well, that's a great question, and I think it's a perfect place to pick up after a quick break. We'll dive into that and more when we come back. So before the break, we were talking about the long-term outlook, right? And one of the things that really stood out in the research was this possible connection between having a parathyroidectomy and, well, living longer, specifically for dialysis patients.
Yeah, that was a bit of a surprise, I have to admit. How does taking out these little glands lead to a longer life? It seems counterintuitive.
It does, doesn't it?
Yeah.
But it makes more sense when you think about all the ways hyperparathyroidism can affect the body, like the strain it puts on the cardiovascular system.
Right, like it's constantly stressing out the heart and blood vessels.
Exactly. So parathyroidectomy, it can actually lighten that load. One of the studies you sent, it showed that after the surgery, patients had way fewer cardiovascular events, things like heart attacks, strokes.
So it's not just about bone health then. It's about protecting the whole system.
Right. The body's all connected,
Right.
Now, we do have to be careful here. These studies, they're observational. So we can't say for sure that the surgery directly causes people to live longer.
Okay, so it's a correlation, not necessarily causation.
Exactly. But the evidence is definitely interesting,
Yeah.
especially when you consider all the other potential benefits.
Right, like the bone health improvements we were talking about before the break. You mentioned that the surgery could actually help reverse some of that damage. How does that work?
Well, think of it this way. Secondary hyperparathyroidism is like this constant drain on your bones. Those overactive glands, they keep pulling calcium out, making the bones weaker.
And more prone to fractures.
Right. But the surgery, it stops that. It's like taking off the brakes and letting the bones start to heal.
Wow, so it's a chance for them to recover and get stronger.
Yeah. Now, everyone's different, and it's not an immediate fix. It takes time. But there was this one study, it found that within 2 years of surgery, people were seeing big improvements in their bone mineral density.
That's a good sign. So it's not just about managing the symptoms, it's about giving your body a chance to really bounce back.
Exactly. And speaking of bouncing back, I think it's important to talk about the emotional side of this whole thing. Making the decision to have surgery, going through the procedure, recovering.
Yeah, that's a big deal. We've been focusing on the technical stuff, but this is a major life event.
It is. There's uncertainty, there are risks. It's natural to feel all sorts of things.
Absolutely. And it's a reminder that health isn't just about the physical. It's about the mental and emotional too.
So true. That's why having a good support system is so important. Your medical team, your family and friends, they can help you through it.
And listener, if you're going through this, don't be afraid to speak up. Tell your doctor how you're feeling. Connect with support groups. You're not alone in this.
Your voice matters. Now, I know we haven't talked much about what happens right after the surgery, the recovery process and all that.
Right, like that hungry bone syndrome we mentioned earlier.
Yeah, that can be a tough one. Remember how we were saying that parathyroid hormone regulates calcium levels? Well, after the surgery, those levels drop fast.
So the body has to adjust.
And the bones, they're used to having all that extra calcium around. Suddenly, they're in a deficit, so they start grabbing calcium from the bloodstream.
Like they're trying to make up for lost time.
Exactly. And that can cause all sorts of symptoms. Tingling, muscle spasms, even seizures in severe cases.
So it's something to be aware of.
Yeah.
But manageable, right?
Yeah, for the most part. Usually it's temporary. Calcium and vitamin D supplements can help. And sometimes you might need intravenous calcium.
So it's not a walk in the park, but it's not a permanent problem either.
Right. Most people, they recover just fine. Now, before we move on, I wanted to mention something that might be of interest. It's a technique called percutaneous ethanol injection, or PEI.
I've heard of it, but I don't know much about it. What's the deal with that?
It's a minimally invasive procedure. So instead of doing open surgery, you inject ethanol directly into the parathyroid glands.
Wow, so it's a more targeted approach.
Yeah. The ethanol, it basically destroys some of the parathyroid tissue. Less tissue, less hormone.
Sounds less intense than surgery, but I'm guessing there are downsides.
There are. It's not as effective as surgery in the long run. And there's a small risk of damaging nearby structures, like the vocal cords.
So it's not a perfect solution.
No, but it can be an option for people who aren't good candidates for surgery, or for those who have hyperparathyroidism that keeps coming back, even after having a parathyroidectomy.
Got it. So it's another tool in the toolbox.
Exactly. Now, before we wrap things up, I want to touch on one more thing. We've talked about how hyperparathyroidism affects bone health, But what happens to those bones after the surgery? Do they just stay damaged?
That's a good question. I mean, we were talking about how the glands are pulling calcium out of the bones. Does that process just stop?
Well, the good news is that the surgery can actually help reverse some of that damage.
Really? So it's not just about stopping the damage, it's about actually healing.
Yeah. Think of it like this. You take out the overactive glands, and it's like you're giving the bones a chance to breathe again. They can finally start rebuilding.
So it's like hitting the reset button on bone health.
In a way, yeah. Now, like I said before, it takes time,
Yeah.
and everyone recovers differently, but it's definitely a positive thing to consider.
Absolutely. So we've covered a lot here. The different types of surgery, the possible complications, the long-term effects. It's a lot to process.
It is. And in the last part of our deep dive, I want to talk about something else that's really fascinating, the potential impact of this surgery on long-term survival. We'll get into all that after the break.
Okay, so we're back. We've really dug into parathyroidectomy for people with end-stage renal disease, haven't we? We talked about when it's necessary, the different ways to do it, the potential issues. But now, let's zoom out and look at the big picture, the long-term impact.
And that's what really matters, right? The long game. When you sent over all this research, one thing that really struck me was the possibility that this surgery, it might actually help dialysis patients live longer.
Yeah, I'll admit I was surprised by that too. It doesn't seem obvious, does it? Like, how does taking out these tiny glands lead to a longer lifespan?
It's one of those things that makes more sense when you step back and consider all the ways hyperparathyroidism can affect the body. Remember how we were talking about the strain on the cardiovascular system?
Right, like it's constantly pushing the heart and blood vessels to their limits.
Exactly. And the surgery, it can help reduce that burden. In fact, one of the studies you sent over, it showed that people who had a parathyroidectomy, they had a significant decrease in things like heart attacks and strokes.
So it's not just about the bones then, it's about protecting the whole system. Pretty remarkable when you think about it.
It is. The body, it's all connected, isn't it? Now, we do have to be cautious here. These studies, they're observational. So we can't say for sure that the surgery directly causes people to live longer.
Okay, so it's an association, not necessarily cause and effect.
Right. But it's definitely something to consider, along with all the other potential benefits.
Like the improvements in bone health we talked about. You said the surgery could actually help reverse some of the damage hyperparathyroidism does to the bones. Can you explain that a bit more?
Sure. Imagine those overactive parathyroid glands. They're like little thieves, constantly stealing calcium from your bones. Makes them weak, fragile.
And brittle.
Exactly. But when you take out those glands, it's like you're putting a stop to the theft. The bones can finally start to recover.
So they can actually get stronger again.
They can. Now, it's not a quick fix,
Yeah.
and it varies from person to person, but it's definitely a possibility. There was one study they found that within a couple of years after surgery, people had significant increases in their bone mineral density. So it's encouraging.
It is. It's like hitting the reset button in a way.
You could say that. Now, before we wrap up, I want to touch on something we haven't really talked about directly, the emotional side of things. Making the decision to have surgery, going through the procedure, recovering.
Yeah, it's a big deal. We focus a lot on the technical stuff, but this is a major life event.
It is. There's uncertainty. There are risks. It's completely normal to have a lot of emotions swirling around.
Absolutely. And it reminds us that health isn't just about the physical, it's about the mental and emotional aspects too.
Couldn't agree more. That's why having a good support system is so important. Your medical team, your loved ones. Don't be afraid to lean on them.
And listener, if you're going through this, remember, your voice matters. Don't hesitate to share your concerns with your doctor, connect with support groups, reach out to your friends and family. You're not in this alone.
That's so important. Now, I think we've covered a lot of ground here. We've really explored this complex topic, haven't we? The reasons behind the surgery, the different ways to do it, the potential complications, the long-term outlook.
It's been a deep dive for sure. And hopefully, listener, you're feeling more informed and more prepared to navigate this journey should you ever need to.
That's our goal, to empower you with knowledge.
As always, though, we have to remind everyone that we're not medical professionals. This is for informational purposes only. The best person to guide you through these decisions is your doctor.
They can take all this information we've discussed and help you make the choices that are right for you.
And on that note, we'll wrap up this episode of The Deep Dive. Thanks for joining us. Until next time, stay curious.